From understanding techniques in textbooks to applying procedures in a lab, students should organize their thinking about patient care and professional nursing practice while in school. BYU College of Nursing is incorporating Tanner's clinical judgment model as a framework for thinking like a nurse. The model is based on over 200 research studies investigating how nurses think in practice and includes 4 areas: notice, interpret, respond, and reflect. Based on the model, let's listen to a few faculty members and nursing students share how they think like a nurse. And while you're listening, reflect on how you think like a nurse.
I think like a nurse by practicing self-care and stress management techniques.
I think like a nurse when I bring the needs of others into focus.
Before I go to the clinic in the morning, I'll often pray for inspiration so that I can give my patients the very best care.
I think like a nurse when I take input from my patients and other healthcare team members.
I think like a nurse when I take the time to include my patient in a plan of care.
I think like a nurse when I listen to what my patients or their family has to tell me about what they feel is important in how I provide their nursing care.
When taking care of patients, I consider the social determinants of health, which helps me better understand their individual needs.
I think like a nurse when I create individualized treatment plans for patients who are each human beings with unique needs and circumstances.
I think like a nurse when I consider my patients' cultural differences and I use that knowledge in my care.
I think like a nurse when I plan my nursing care based on evidence-based practice.
I think like a nurse when I take every aspect of my patient's health into consideration.
I think like a nurse when I reflect on my patient care at the end of every day to improve my clinical judgment.
I reflect on my nursing care interventions to become a better nurse.
I think like a nurse when I think about the why behind what I'm doing.
I think like a nurse when I have a prayer in my heart each time I go to clinical and take care of patients, just so that I can be guided and directed to better care for them and make their day better.
I'm still learning to think like a nurse, but right now I'm working on noticing.
I think like a nurse when I think critically, seek learning continually, and remember to maintain a perspective of my patients as children of God.
I think like a nurse by using the Team Steps principles in my interactions with my patients and my fellow caregivers. I also love teaching the Team Steps elements to my nursing students.
I listen carefully to my patients and plan my care based on their individual needs.